Dr. Gibson Gray. Welcome back to Little U Life. We're back again with another great lesson on an extremely important subject for preemies. Today we'll learn all about IVH, or intraventricular hemorrhage, and the later complication of hydrocephalus that can affect our littlest patients. But first, we need to know a little bit of anatomy. The brain has two sides, and each side has a small fluid-filled space right in the middle. In a normal brain, these spaces look like little slits when we look at them on an image, but they will get bigger if fluid starts to accumulate in them. Now, back to our problem. IVH stands for intraventricular hemorrhage. This means bleeding into these spaces called ventricles. IVH can lead to many long-term developmental problems like CP or cerebral palsy and seizures, among other more mild developmental problems. The smaller and earlier a baby is born, the higher the risk they are for IVH. And this goes down with the increasing gestational age as they get more further along in pregnancy. A number of things can contribute to this risk, like low blood pressure, the need for being intubated and having mechanical ventilation, and a low birth weight. We use 1,500 grams in general, which is a little over 3 pounds as kind of a cutoff for what is too small. And the majority of babies, over 95% of these bleeds that happen, they happen in the first 4 to 5 days of life. So, for this reason, the standard of care is actually to wait until the window of risk is over and then look for any bleeding that has happened with an ultrasound of the brain. If bleeding has been found, then we want to grade it. How bad is it? 1 to 4, with 4 being the worst. Let's discuss grading, since it affects the outcomes. The higher the grade, the worse the potential outcomes. Statistically, grades 3 and 4 increase the risk of developmental problems above that of prematurity alone. Grades 1 and 2 do not necessarily increase this risk by themselves. It is not an absolute, it is just a risk, since I've seen babies with grade 4 bleeds and very good outcomes. And unfortunately, I've seen vice versa. I've seen babies with almost no bleeding who have had significant neurologic impairment later on down the road. In short, sometimes. IVH sometimes causes symptoms, but usually they are asymptomatic initially, which is why we have to have a standard of when we look. Because a baby may not look any different when they've had a bleed versus when they don't have a bleed. But we can sometimes see a large drop in the hemoglobin level if we're watching their labs. On occasion, there may be more apneas and bradycardias, and sometimes they can actually start to have seizures. So what can we do? There's actually no direct treatment to get the blood out of the brain once it's happened. Primary goal with IVH is prevention. So we have several things that have been shown to reduce the risk of IVH. First, delayed cord clamping. Up to 60 seconds. We're not doing any of this lotus birth or strong long-term delayed cord clamping, let it fall off naturally. No. A little bit of delayed cord clamping has been shown to reduce the risk. Minimal stimulation during that window of risk that's the highest. This is the hardest thing for parents, since it means they can't hold their baby during this period. Gentle ventilation techniques. We have very specific things we do with the ventilators, and we don't want to over-ventilate, we don't want to under-ventilate. Head positioning. We want to keep the baby's head midline. We don't want to keep their head moving from side to side. Some places will have head positioners. They'll make sure that they keep the head midline. And then lastly, we want to avoid things like infection, severe anemia, and a low blood pressure. All of those things are going to reduce that risk for bleeding. Standard of care is to follow ultrasounds of the brain once you're outside that window of risk, usually 5 to 7 days of life. If any bleeding is found, more imaging is usually done to watch to see if it gets worse or if we start developing hydrocephalus, or something called PVL. What is PVL? PVL stands for periventricular leukomalacia. I know, mouthful. It literally means whitened areas outside the ventricles. And this refers to what we see on an ultrasound when we look at a brain that has had some type of damage from lack of oxygen or bleeding that has happened. It looks white on ultrasound. So that's where that name comes from. This is actually highly predictive of poor developmental outcomes, even above bleeding itself. So how does IVH cause hydrocephalus? IVH can lead to hydrocephalus because the blood can block the flow of the spinal fluid, which leads to an accumulation of fluid in the ventricles. I think of this as clogging the pipes. If this becomes severe, it can compress the brain tissue just outside the ventricles and damage that portion of the brain. And sometimes a baby may require surgery to insert a small tube to drain the fluid out of the brain. This is done by a neurosurgeon. There are different types of drains, so we won't go into detail here, but the idea is the same, to decrease the size of the ventricles and protect the surrounding brain. Well, that wraps up our discussion about IVH and hydrocephalus. As always, if you have questions about your baby's specific care, you can talk to your neonatologist or other healthcare provider, and don't forget to check us out online at LilU Life for more great videos and resources. Comment below to tell us about the LilU in your life. Thanks for watching. We'll see you next time.